All right, the next thing we're going to do is work on hip on axis in the frontal plane, working on improving the ability for the hip to sit relatively in an abducted position. A lot of hips, when there's any amount of weakness in the pelvic girdle, when you go to put all of your weight through one foot, typically people will either kind of sit into that hip, or they will compensate in some way, lifting the opposite side of the pelvis, using the QL, something that kind of gives you a cue off that, for some reason this hip likes to sit like this. So in my head, in my PT nerd brain head, I want the hip to relatively have the ability to sit like this. And that motion is relative abduction. So I'm gonna show you how I do this. I always pretty much jump directly to using the belt on this one, because you do have to be kind of aggressive when you go to mobilize the hip into abduction. So I have, don't mind my phone noise. I have the belt up to the greater trochanter, just at the very top portion of her greater trochanter, because that's going to be my fulcrum that I want to use in order to sit the femoral head kind of more medially in acetabulum. So this one, my foot comes up on the table. I bring her leg up and back. Woo, and she's tight there. So some people, you really need to work on the pliability and the extensibility of the adductors, and you can inherently do that while you do this joint mobilization, because we're going to use those muscles to mobilize. I am also making sure her pelvis stays stacked. So in this position, I'm bringing her pelvis forward, and I'm bringing her hip relatively back. Now everything is still in one straight line. So I'm purely working in the frontal plane here. So I'll rest the leg on my leg, but I like to kind of cradle and get right underneath the joint line of her knee, just from a comfort standpoint. I will then walk my foot out a little bit, okay? Notice how I don't have a huge loop in my belt, because I don't want to have to adjust it a ton once I get into this position. So it's a smaller loop overall. And then from here, I go into, and this is, I've had to think about what I do to bring more tension into where I want the tension right here on the greater trochanter. And what I actually do is go into inversion of my foot. So I actually invert to put more tension on the lateral aspect of that belt, and you feel how that puts more tension versus that. Mm-hmm. So as I do that, that puts more tension there. And then I can have K pull down. Good, and now I have a stable system that she can pull down into, and I'm not having to stress and strain a whole lot, and let it go. Good. And then I will just kind of take up that slack as much as I can. And as I take up that slack, I'm kind of weight shifting away from her to try and decompress that hip. As I take up slack, go ahead and pull down. And let it go. Good. And let's say that, basically I just keep mobilizing until it feels like nothing's really improving. So let's say we're there. So now I want her to be heel high for the re-education portion. Reach long through your leg. Keep the heel higher than the toes, right there. Keep it up there. Keep it up there. Keep it up there. And I let go of my help. Keep it there. Woo, and this is hard. She can't keep it there. So I'm actually helping assist her to stay up. I'm not gonna put my hand on the opposite side to provide a little resistance, because she would just go down, unfortunately. Okay, and then we could, if she was strong enough, we could have her, this is not meaning to be demeaning, but we could have her go through range to kind of go into that re-education phase. Ideally, I'll be able to resist it through range though. Okay, let that knee bend up. So that is hip on axis into abduction.